This podcast contains discussions on sexual misconduct. Topics such as sexual exploitation, abuse, and harassment may be discussed. Listener discretion is advised, and we encourage self-care and seeking professional support as needed.
Having reviewed the research evidence, we found huge gaps in the data, but women health workers everywhere have told us that sexual exploitation, harassment, and violence was an everyday experience.
In this episode, I speak to Dr. Roopa Dhatt, Executive Director and co-founder of Women in Global Health. She provides data to help us grasp the underlying causes of sexual misconduct in the health sector, drawing parallels to the international aid sector. She also discusses research gaps, highlighting the need for a better understanding of the prevalence of perpetrators and the enabling factors contributing to their actions.
We would be in a better position to design laws and policy solutions to stop abuse if we understood more why men abuse women health workers. But this is the area of research. There's a lot of focus on victims, very little on the perpetrators and what is really creating the environment for them to be enabled, but also what allows them to take advantage of power.
Despite the current lack of research in this domain, she advocates for the inclusion of civil society organizations in the discussion and decision-making processes aimed at safeguarding operations on the ground for local communities.
Too often, civil society organizations are encouraged to engage, but there aren't systems set up for them to engage. They're an afterthought, and what we've seen is WHO really actively bring civil society in. It's been creating an enabling space to foster that kind of dialogue based on understanding the unique power of civil society organizations.
This is the #NoExcuse podcast. We discuss the challenges, complexities, and potential solution in preventing and responding to sexual exploitation, abuse, and harassment in the humanitarian and development sectors. You'll hear interviews with victims and survivors, experts, aid workers, artists, and leaders. The podcast is produced by the World Health Organization's Department for the Prevention and Response to Sexual Misconduct. I am Guni Dias, your host and Global PRS Network Coordinator for the department. Welcome, Dr. Roopa Dhatt, to WHO's #NoExcuse podcast.
Great to be here.
So thanks to Women in Global Health, we had the pleasure to have Memorika Chambois from Femnet, which is a civil society organization who works on the ground with communities we serve. And she was a great guest on the podcast, but she was also there during the stakeholder review meeting held in Geneva. And I think this is a perfect example of the collaboration between Women in Global Health and WHO. So would you mind, Roopa, to tell us more about Women in Global Health and their work, and give us examples of the collaboration you have with WHO in the prevention and response to sexual misconduct?
Yeah, would be happy to. And I'm so glad you got a chance to talk to Memory. She's such a fantastic advocate on all of these issues. So a bit about us, Women in Global Health. We launched in 2015 around the issue of women's leadership in global health. And we have always highlighted the harassment and violence faced by majority of women in the health sector as a rights abuse needing urgent action. So following the appalling revelations from the sexual misconduct case in DRC, Women in Global Health has worked whenever we could to support WHO to driving the lasting change. We particularly have worked with the African feminist organization Femnet, who was just featured in your podcast with the interview with Memory. We convened over 200 NGOs around this issue, majority of them being women's organizations from Africa. And just to give you a couple of highlights of the way that we've collaborated with WHO, for the past 3 years, we've been working with WHO to support combating sexual misconduct in the health sector through evidence generation and advocacy. We have joined as partners with WHO to mount a series of global and regional town halls, bringing together stakeholders from governments, international organizations, civil society organizations, as well as activists, researchers, and legal practitioners. We are all looking for solutions. In October 2023, we hosted a consultation with civil society organizations on prevention of sexual misconduct in collaboration with COSAMED, an organization based in Democratic Republic of Congo, to feed into the WHO work. We also know that eradicating sexual misconduct in global health is impossible. Nevertheless, that remains our ambition because we know we cannot undo the terrible damage that's done to victims. We have been really impressed with the huge amount of investment by WHO in capacity building, codes of conduct, processing of cases. And since the case in DRC, we've seen really a transformative change take place in the organization and the ripple effects being felt more widely. To give you some examples, we have seen that significant impact. We know it takes determination and leadership to drive change, especially organizational and cultural change in a dispersed global organization. But we are seeing that happen. And the words of not just myself, but our collective movement, Women in Global Health, we say this after being one of the organizations that also called out that the need for accountability.
Did you see WHO evolved in a certain way? And what does that mean for women in global health?
We are really truly seeing a change happen. To give you a story from one of our colleagues, they were recently visiting a WHO country office in Africa, and they came across a poster and a code of conduct in the office that were both explicitly addressing sexual misconduct in a very prominent public space, so that it's not just targeting the people that work at the WHO office, but it's everybody that's coming in is being told there is zero tolerance that we would not have seen 3 years ago. So that's an example of where it's not just what's happening in a headquarters situation, but it is something we're seeing really with uptake in country offices. And we urge WHO to continue with this change project until it's fully embedded in policies, procedures, hearts, and minds. Women's organizations are critical partners in prevention and asked to be included at all stages from policy design to service delivery. And so for us, this collaboration with WHO has been really based on understanding the unique power of civil society organizations and particularly what women's organizations bring to the table, and even going further and making sure we're bringing women's organizations from the global south, from the community level where these issues are playing themselves out. And that's the key, is that too often civil society organizations are encouraged to engage, but there aren't systems set up for them to engage. They're an afterthought. And what we've seen is WHO really actively bring civil society in, has been creating an enabling space to foster that kind of dialogue and continue dialogue, is exactly why we find this partnership very meaningful for us to continue to engage in. And seeing some of the recommendations that we've been putting forward over the years being integrated into the different work plans and strategies, and then being able to pick up and work collaboratively and also introduce other organizations, other civil society organizations and partners into this process. And what we've seen is an evolution and much more commitment, and also not just a short term vision, but a long term vision.
I'm glad to hear that organizations like yours can see and feel the evolution that WHO is going through. I'd like to touch upon the report. In 2022, Women in Global Health released this HealthToo Policy report. I think it's quite a unique piece, especially the approach taken to write it. Can you tell us a bit more about it?
In 2022, we published a policy report titled Her Story: Ending Sexual Violence and Harassment of Women Health Workers. So if you haven't checked out that report yet, highly recommend you do. It's quite a moving piece of work. It was accumulation of our HealthToo research project, an online platform, and we included personal stories shared by women health workers who have experienced workplace harassment and abuse. In the absence of really having comprehensive data on sexual misconduct in health, our report uses the power of testimony and the use of testimony of women as data to bring the everyday reality and nature of the problem to life, as well as the conditions that enable it. The harrowing stories we have shared make it harder to ignore the damage done by sexual misconduct to victims, and also the wider damage done to our organizations, health systems, and societies. We don't really have an ability to capture and puts the human side into it, and particularly shows how pervasive the issue of sexual harassment, exploitation, and assault is in the workplace in the health sector. And it spans across cultures, it expands across generations, it spans across the type of job or profession one may have within the health sector. So, really encourage the listeners to glance at that, because it really puts the human side to what's really taking place.
Could you share with us some of the factors that lead to sexual misconduct in the health sector? Because, of course, we can draw some parallel between the health sector and the aid sector, but also what is the data around it? You have qualitative and quantitative, where you've spoken to 235 women. You must have learned a lot from it. So, could you share with us some of the data, and that would help us better understand the nuances and the difficulty around this complex issue?
Yeah, happy to give some highlights and definitely encourage to check out the report. So, just to frame the way we're looking at the issue of sexual misconduct in the health sector, is that they are two related issues. So, sexual misconduct by staff and organizations in health, like WHO and other NGOs, relates to abuse of beneficiaries, women, and children in communities, not only in health, but also in peacekeeping. So that's one area, the sexual misconduct by staff and organizations as it relates to communities. The second is sexual exploitation, abuse, and harassment as an abuse of an employee and worker. Generally, abuse of women by other senior employees, patients, men in the community, and Women in Global Health is focused on compiling evidence on this area particularly. So, talking about what's happening in the health sector, what's happening in that environment. In 2022, having reviewed the research evidence, we found huge gaps in the data. But women health workers everywhere have told us that sexual exploitation, harassment, and violence was an everyday experience. We therefore set up a HealthToo platform where women could lodge their testimonies and compile those experiences into a hard hitting policy report. And as a practicing physician myself that has gone through that journey in a high resource setting such as the United States, I can say that this reality exists even today. There are very limited reporting mechanisms and very little being done to capture what is taking place. And it is something that I see colleagues, as well as those that I'm supervising and training, reporting that they are facing sexual harassment nearly on a daily basis in some form. And I'm not shocked when I see those reports where they say that at least two-thirds of women in the health and care sector will report some form of sexual exploitation, harassment, and violence. But we wanted to focus on the testimonies, really give these numbers the human side and surfacing what's really taking place. So our conclusions were that sexual harassment and misconduct at work both have the same root drivers. They are symptoms of unequal power relations between women and men in the workplace and in wider society. You don't have to look far to recognize that when you take a look at who has the greatest power in our world and societies, it's still skewed significantly toward men. And those numbers have been fairly stagnant. Looking at head of states, parliamentarians, coming into even private sector, you can see that across every aspect of our society, academia, and this is work that Women in Global Health has mapped out within the health sector. And we say 70% of the health and care workforce are women. But when you take a look at who's leading, 25% of those leadership roles are occupied by women. And I'll unpack that data a bit later if there's more interest in it. But to go back into this unequal power relations, what we found is that it's less about sexual desire and more about some men exploiting and reinforcing the patriarchal norms and cultures that put men into superior positions. And I want to really highlight that because there's often a tendency to say this is related to sexual relations, sexual desire. And what we're saying, no, this is about power and it's about patriarchal norms and it's about often the male sex gender showing dominance. And that puts men in superior positions. And men do this because they feel they have impunity and will suffer no cost. It's acceptable for them to show and demonstrate the power they have. And other aspects we are highlighting is that we are working blind and without comprehensive data. And that becomes an enabling environment. We know, given that stigma and retaliation, that victims rarely report. So, the true extent of sexual misconduct and harassment, until governments and employers routinely collect such data, we will not know how representative our stories are of the health sector globally or locally. And that data gap and us working blindly means it is an enabling factor for abuse to continue. Many of the male perpetrators appear to be serial abusers, so they're enabled by silent bystander culture supporting a patriarchal culture that enables them, that legitimizes and downplays and perpetuates sexual exploitation, abuse, and harassment against women. And so it's not uncommon to come into a situation and see that a known perpetrator has been in a position of power for a long time, and many have been silent bystanders. And that is why the conversations around how do we convert the bystanders to upstanders or really address what's happening there. But again, it goes back to the point that the men in power know they are enabled. Women's experiences of SEH and trauma is downplayed in the health sector and is even normalized. So when women do report what's taking place, it's again purposefully excuses such as this is the cultural traditions or this is a generational issue. Women experiences are often downplayed and even normalized, and that itself is problematic. We need to recognize the victim is never responsible. Without victim centered reporting mechanisms, abuse is unrecorded, unsanctioned, and has a cost primarily for the victim, while the perpetrator is enabled to continue their pattern of behavior. Other findings from our analysis show that the true silent voices are those of the perpetrators themselves. Only some men take advantage of power imbalances and other enablers to abuse female colleagues. We would be in a better position to design laws and policy solutions to stop abuse if we understood more why men abuse women health workers. And yeah, I am saying that we're on a podcast, so I can push the envelope a bit more, but this is the area of research. There's a lot of focus on victims, very little on the perpetrators and what is really creating the environment for them to be enabled, but also what allows them to take advantage of power. And the cost to victims are hidden and high. And anytime we believe that we are going to be able to repair this damage, we're completely deluding ourselves. And there are a lot of different narratives that an individual may go on to take to be a survivor, to be a victim, to be all of it at once. But the reality is, once the damage is done, the repair is nearly an impossible task. So our greatest approach and solution to all of this is prevention.
There was one title from one of the chapter in the report that really struck and I think can summarize some of what you've been saying is global health delivered by women, led by men. And I think that speaks to the 70% female health workers and the rest is men. And so in your experience, what are some of the things you learned on this subject, more specifically in the health sector, that you think can help the aid sector to tackle sexual misconduct?
Goody, I'm going to pick up on the point you just made. Our leading solution to this is ensuring that men and women have equal power in the health sector. And one could even make the case that women should have more power because they make up majority of the health and care workforce. But we are about gender equality at Women in Global Health. So for us, getting that power relation dynamics correctly is something that we need to do in the health sector, but more widely, as you said, the aid sector, and then it falls into the broader societal context. But as we focus in specifically on how do we tackle sexual misconduct in these settings, first is really, from our point of view, recognizing that civil society organizations are already playing a critical role in ending and responding to sexual misconduct through advocacy, raising awareness in the community to the global levels. They're demanding change, supporting survivors. And we could do much more, but civil societies, especially women's organizations, are chronically underfunded. In our work, I was astonished, and I should say I shouldn't have been leading such a large organization, but there wasn't a single community that we didn't try to connect with where there wasn't already an existing women's rights organization working on these issues, and sometimes multiples in places one would assume, oh, there mustn't be any. But reality is that the people in these communities are resilient and responding, and the women in these communities are responding to the trauma that they face. So there is no surprise that civil society organizations are already out there and working on these issues, but they are not funded, severely underfunded. any of the global data that looks at how much of overseas development assistance actually gets into the hands of women's community groups will show you that even in the large bucket of gender equality, less than 1% actually gets into the hands of women's communities, grassroots organizations. And these are the groups that are addressing these issues. So, how do we make sure that civil society organizations, particularly led by women working on these issues, are funded is a top priority? And progress on ending sexual misconduct is slowed by weak legal and policy frameworks that make it hard to seek justice for victims. We have seen this play out in so many different settings. Definitions of sexual misconduct can be unclear, open to misinterpretation, and contribute to poor quality data. And we see an opportunity with a convention by the International Labor Organization called ILO 190 on violence and harassment that can be an enabler on creating clarity on definitions and stronger legal frameworks. But we know that this ambiguity creates an environment where it's harder to seek justice. The third area we would say is that sexual misconduct is enabled by power imbalances between mainly male perpetrators, supported by patriarchal gender norms, and victims, mainly women and children, who are unable to come forward and report or unwilling due to the stigma and shame and fear of retaliation. We, in our report, had one testimony where a woman physician in India had reported an incident of sexual exploitation. And what ended up happening in her institution was, instead of that issue being looked at, she was labeled as a troublemaker, faced blatant retaliation, was not promoted. And at the end, she felt that the only way she could have continued career progression or even feel enabled in her workplace was change to a different health system in that setting. And so we know that this is playing out over and over. So measures for prevention and response must be tailored to the cultural and socioeconomic context based on the testimonies of victims and CSOs that can support them. We say there isn't one solution for all. It really must be tailored, but we know that the power imbalances in every society and context must be looked at. This is going to be another provocative statement, but in our experience, we are seeing that women are rarely the perpetrators of sexual misconduct. So, gender equal leadership is critical to changing organizational cultures and addressing bystander culture. And to be very upfront about it, we have had already a male dominated leadership and power in global health organizations for so long and in our health systems for so long. We say at Women in Global Health that health systems are designed by men for men and continue to keep men in place. And until we change that, that is why we talk about getting women into leadership roles in equal numbers at all levels of the health system. Sexual misconduct is not a women's problem, and all leaders must really take intentional steps to end it. Men are critical allies and also critical decision makers, but we must recognize where that power imbalance is. The other areas that we are also recommending is that sensitizing and mobilizing communities to raise awareness of sexual misconduct and the rights of people in communities in a humanitarian context, particularly, is essential for prevention. So this will include awareness of complaints, whistleblower mechanisms that must safeguard those at risk and ensure confidentiality. Many communities are unaware about what their rights are, especially displaced populations, and also finding mechanisms that work for that particular community. We've all heard it. There are hotlines created, but very little uptake at times. So what can we do to really make sure those mechanisms of reporting are used? And then on the other end, when the complaint is received, that the victim is protected and is safeguarded. And so those are still implementation challenges and uptake challenges, really working with communities to raise awareness and address their concerns in a way in real time when they say this system is not working or we don't trust the system, making sure that we're being responsive in a way that we are to the broader emergency. And then 6, preventing sexual misconduct, which must be our overall goal, requires a long-term culture change and sustained efforts by CSOs being part of a multi-stakeholder approach. It is essential that civil society is enabled to work together to maximize impact and avoid duplication. In addition to service provision, hold each other and governments and international agencies to account. And we talk about in gender equality that the estimates to achieve gender equality in society say that sometimes estimates say it's going to take us 100 years. And the most shocking number I heard last year was by UN Women that if you factor in equality based on legal practices, it's going to take us at least 250 plus years. And so when we talk about addressing sexual misconduct, it must be with a long term strategy. And in no way am I saying we should be taking 100 years to get anywhere. I think we should be able to achieve this within a generation. And so let's work and stay committed and ensure that we're doing it in a multi stakeholder approach. And then I've already talked about the importance of data. Data brings accountability, and especially in our field of global health and the aid sector as well. Without data, there's very little accountability. So, in the absence of data, prevention and response strategies should be informed by the testimony of survivors. However, we should still be making the effort to encourage global tools to be created to capture what is taking place. And civil societies can be a great mechanism to support gathering and telling of survivor stories, including through media, to bring this largely hidden abuse to light.
If I were to summarize, really your advice for any aid agency to tackle sexual misconduct committed by aid workers is really to increase data collection so that we can rely on that to make decisions, rely more on civil society organizations in how we operate, and listen more to victims, raising awareness among communities about their rights and provide reporting mechanism that they trust, and then finally have more women in leadership. So, to end on a personal note, as a woman of color and a leader, what is your advice for women in the aid and health sector?
Yeah, so I'm going to give the hard advice up front. I would say that having been working in global health for some time now, but having now led women in global health for 9 years, I would say the first thing would be know it's going to be difficult, but
Mm.
do it anyway. As Helen Clark once said, as a woman leader, don't expect a red carpet. I will say that is especially true for a young woman of color. And for those that can't see me on video because it's a podcast, yeah, I have a bit of gray hair showing on today's podcast. But even though I don't consider myself young, as a woman, you're labeled, and a woman of color, you're particularly labeled. It's not easy, but stay committed, be persistent, and know that you're not alone. Find your tribe. And when you don't find them, create a platform, as we've done at Women in Global Health, to convene a tribe. It's inspirational for me to have women in our movement that keep me motivated from all different backgrounds, geographies, age groups, parts of global health and wider development. And it is really that community that keeps refueling me to do the work that I do on a personal front. Our story of Women in Global Health started in 2015, and I launched it with three other co founders. We met on the platform Twitter. And as early career women, we were looking at global health space and seeing all these amazing women from all over the world in a sector. Many we viewed as our role models, and they were majority women. But when we looked into the leadership roles, women were evaporating as they went up in the hierarchy. In my own personal journey, and I was training, and I saw myself entering a clinical setting where women were the majority of the health workforce, majority of the nurses, majority of the health aides at the bedside, in training and graduating. But when I walked that hallway every day for clinical rounds, I would see that classic hallway of photo after photo of a white male being decorated and celebrated. And there was a point where our department was getting ready for a new chair, and there was hope there might be a woman. And of course, it went to a white male already from that background community. And I just couldn't see myself being part of this system and sector without changing it. And so that's what inspired me. And it still fuels me today because I see those gender inequities and intersectionality inequities that all play into who has power and who makes decisions and who does the work. And so that's what fuels me. And so the majority of leaders in powerful positions in global health are men, and the majority of those men come from global north. I've shared the research that we did on this in 2015. We found that 25% of those senior leadership roles in global health are occupied by women. And then in just last year in 2023, we did that research and we found the number remains stagnant at 25%. It hasn't even budged across looking at decision making, political leaders, academia, private sector, and it just shows you how systemic these barriers are. And the pandemic, we even saw a significant drop in women's leadership, which seems to be recovering back to pre-pandemic. But there were several examples of where women were sidelined and sometimes even removed from formal leadership posts or ministerial posts because there was crisis. And when it's crisis, and when there's an emergency, there is a tendency to turn to masculine leadership, men particularly. And we know how that has played out over and over again, including in the pandemic. So I would say that you have to channel these lived experiences, especially when there is crisis and emergency. We know that women are going to face even more difficulties. So my advice, really goes back to know it will be difficult, but do it anyway. But it's important to know for those women that are coming into this space, especially women of color, that it's not an easy pathway. But I don't want to lead you down a pathway of a downer, but say that it is possible. And I go back to collective action at Women in Global Health. We practice collective action. I myself, in my own leadership journey, have found power in being in networks, in communities, doing things with others. And it was really through that collective power that we've been able to address a lot of the challenges we faced. And we continue to face challenges as being a women's rights organization. I talked a lot about power today. Expect to be attacked from all sides. I was warned a bit about that's going to be part of the journey, but having gone through it, I would say that don't underestimate that and count on your tribe. We say that women need to have the skin of a rhino and good people around you to protect your own heart and find the persistence to carry on. And when you face that backlash, know you're making progress. And I just would say that Women in Global Health is going to be 10 years old in 2025. And many times I look at the bank balance and wonder if we could make it through another year. But here we are, stronger and louder than ever. And we have a power of a movement of women, and we aren't going anywhere until we have gender equality. So stay persistent.
Thank you, Roopa. That was really powerful. Thank you for the work you do.
Gunny, it's been really an honor to be here and have this conversation. I just am very enthusiastic about the work that is taking place, led by the World Health Organization. It truly is standing out as an exemplar in the sector. And as I've said to Dr. Tedros, the DG of WHO, that in my latest meeting to him, that I'm truly seeing the mind set transform at WHO. And that's leading to a transformation with other partners. So count on us at Women in Global Health to continue to partner on this long journey. Thank you.
Thank you for listening to this episode of the World Health Organization's #NoExcuse podcast. We hope we've given you another perspective on preventing and responding to sexual misconduct in the humanitarian and development sectors. We release new episodes every 2 weeks. But if you have any feedback, questions, or suggestions in the meantime, feel free to reach out at prseah@who.int. Until the next time, goodbye.